CBME represents a real change in how we educate and assess residents. CBME is very much learner-driven, where there are certain EPAs, entrustable professional activities, that the residents are going to be taught so that we can entrust them to do professional work with patients, whether it be surgery, whether it be clinical care. But the key here is the method of evaluation is far more granular, far more observational, and I believe that at the beginning, people felt a significant resistance to this change because all they could see was more work being put on their plate. First of all, it was important to just publicly say that this is an important change, but acknowledge it's going to be tough. From a staff level, I think the lessons we learned was the importance of having the right glossary and language and seeing these milestones and EPAs in person. It was very difficult to talk about CBME until we all knew the right language, the right wording, and saw the evaluations all in person, and then it suddenly started to make sense. We were able to show the residents that this will give them a more granular, more meaningful educational experience than they currently would have had with the older evaluations. An older evaluation, for example, would come at the end of a rotation, which could be even 2 months. It's hard to capture 2 months worth of observations in one evaluation. Whereas under CBME, the resident could theoretically send you an evaluation every single day if they wanted to. So you're capturing in-the-moment feedback, and people really like that.
I think a big thing that I find very successful for our implementation is the transparency. That we had town hall meetings with the program director and also with other staff. We can always bring up our concerns or have questions. There's a lot of back and forth communication. It's very clear to us that the staff take this very serious. So I think from my personal point of view, it's good to know exactly what we expected to achieve at certain points of our residency and what we still need to work on. I think it's great as resident to get that constant feedback and also see measurable improvement over time.
From the residents, especially for the incoming cohort in our program this year who are fully CBME, it's engaging them from the beginning in the culture of CBME so that they know that what they may have seen as a medical student may not be what they're seeing as a resident, but show them also the excitement of this. This is a great change. It's going to give them better teaching. It will give them better training and better evaluations, and I think it will make them better surgeons.